Welcome to Radio Reverrb with CEO and host Susan Brender. Podcasting is a vital way to be a voice in your community and be empowered in your work or cause. Join Susan Brender as she teaches the art of podcasting to adults and youth from all walks of life all across the globe. Here's your host, Susan Brender.
I'm Susan Brender, and this is Radio Reverrb. Today we have a guest who's been on our show several times, and he's always very interesting because he's got information and education about physical therapy. Now, for those of you who don't know what physical therapy really is or really does, he's going to answer all your questions. And I really want to start out, Scott, by asking you, I want you to define for our audience what physical therapy is.
Well, physical therapy is the science of movement and function, and physical therapy is a profession where we attempt to try to restore one's function after an injury.
Now, Scott Miller is a licensed physical therapist in the state of Florida and an active member of the American Physical Therapy Association. He's certified health and fitness instructor by the American College of Sports Medicine and a CPR and first aid certified by the American Red Cross. Now, with all of that in mind, it's really interesting to note that he's done a lot of work with people, and this is what I want to know, Scott. Now, has anything changed since you started your practice in physical therapy? What are some of the things that you're seeing now that you didn't see then?
Well, physical therapy has been around for over 50 or 60 years. It really started to gain popularity after World War II when veterans were coming back injured, and physical therapy really had a big boom working on veterans. But when I got into physical therapy about 13 years ago, we are continuing to treat people of all ages, from 8-year-olds all the way up to 98-year-olds, working on specific injuries or post-surgery rehab, or just helping someone get stronger.
Okay, let's talk about something that I think people will be, really interested in, and that is, now there's been hurricanes going on virtually all over Florida. I mean, certainly they've wiped out the people in Caribbean and Puerto Rico and various other places around the world. Now, with that in mind, what kind of injuries are they having, and can you tell us what you're doing about it, what physical therapists can do about it, and what the problem really is?
Yes, absolutely. With any type of storm preparation, if you've been through it or not, it involves a lot of heavy lifting. Whether it's hanging your storm shutters up or closing your storm shutters, lifting heavy containers and cases of water, moving furniture from your backyard into your garage. And that's all pre-storm preparation, where you can see a lot of back injuries and shoulder injuries just based on poor mechanics and just lifting things they're heavy or fatigue, or you lift something the wrong way. And then you do see quite a bit of post-storm injuries as well, which is a lot of similar type injuries, but it's more of the cleanup phase and putting everything back and lifting these very, very heavy shutters. And you do see quite a bit of back and shoulder issues after a storm, just because of all the debris that has to be picked up and all the furniture that's moved back and shutters that are now taken down, and and these are movements that if you're physically fit, should not be a problem. But this this is something that has to be done on every single person's home. And if you are not as physically fit as other individuals are, you certainly are more susceptible to back issues or even shoulder issues if you're not lifting something properly. So poor mechanics is a big factor with a lot of this.
Now, we're expecting other hurricanes and other disasters to hit all over the world. I mean, right now there's an alert for another hurricane coming perhaps to New York and places of that nature. Now, when somebody realizes that and knows that there is going to be a storm, what are the first things that they should know? Give us a list of things that they can do that will help them be able to, sustain the problem.
Well, it's just like with any type of lifting or body mechanics with the way you move, there are proper ways to do things and improper ways to do things. So if you are used to lifting heavy items, you've probably been educated or you have read about the proper ways of lifting something heavy. If you have never really lifted something that heavy or you've never been told how to do it, most likely you're going to lift something the wrong way, and that doesn't necessarily mean that you're going to instantly get hurt, but you're just at a higher likelihood of getting hurt. So in the case of having to lift heavy shutters or furniture or boxes of water, cases of water, my recommendation would be, and there's a lot of resources. My website is certainly one resource that goes over a lot of good information with ergonomics and body mechanics when lifting. But that's probably the most important thing before you lift anything heavy, and that goes, that's the case for anything heavy, not just in hurricane preparedness or post-hurricane cleanup. It's very important just to be in the know of proper mechanics when lifting things.
Now, there are a number of things that you have on your website, and one of the things that you talk about is your doctor, meaning any doctor doesn't necessarily suggest a specific therapist or clinic. Now, if that's the case, how do people find their physical therapist, and what are the questions that they need to ask you if they want to, get involved with you?
Well, every single state has different rules with what is needed to get into either a physician's office or a physical therapy office or any medical provider. And every single every individual insurance plan has different stipulations with what is needed to get in. So, my recommendation is to do some research, find a good, educated physical therapist. A lot of times a good physical therapist is found mostly by word of mouth, by somebody who had some good experience there as well, and that's where we see quite a few of our patients from as well, and just getting a good name in the community. And they can certainly speak to the therapist and go in for a lot of therapists offer free consultations and evaluations, and you don't necessarily even have to be injured to seek a physical therapist. We're movement specialists, so we work on patients and clients all the time just with overall body mechanics and posture and strengthening, and we go over a lot of these issues that can prevent someone from getting hurt as well. So physical therapy and just an overall strength program is recommended for everybody.
Now, again, on your website, you say one has to pay attention during the assessment. Okay, so what do you mean by that?
Well, pay attention in relation to a patient coming in for an assessment. Is that what you're asking?
Correct.
Well, when a patient comes in for an assessment, we are doing a full body evaluation on a patient on a specific movement or a specific deficit that they're having, and we are paying specific attention and detail to any deficits that they may have or weakness that they may have, and we're going to address those specific things to help develop a good and solid treatment program for that individual patient. And while we go through this evaluation and treatment, the patient is there also being educated on these proper movements and these proper exercises, and is given homework and exercises that they need to do to ensure that they are following through with the proper physical therapy program.
Now, you're located in Delray Beach, Florida. For people who live in the area, give them an idea about why they should see you. I mean, there are so many people who are physical therapists and lots of chiropractors and all kinds of other doctors that can treat people, but why Scott Miller?
Well, we cater to the individual who really wants therapists that pays specific detail and one-on-one attention to that patient. We are a nice family-oriented clinic. The patient is going to be being seen by the same therapist every treatment. Really gets to know my team. We have a small team of 3 therapists, so that everybody gets to know each and every therapist, and really develops a nice one-on-one treatment approach when they get their treatment here.
Mm-hmm. Scott, you also say on your website that people shouldn't be afraid of little or possibly a lot of discomfort. I'm sure people who go to physical therapists understand that they're dealing with a lot of problems, and as a result of that, they're going to have a lot of pain. So what do you tell a person who comes to your office and says, oh, my God, I can't move, I can't walk, I can't sit, I don't know what to do? What approach would you take?
Well, that's that they made the first right step is to seek help, and they came in for some treatment. So we try to discuss with them we have to kind of find out why they're in this much pain, and we have to get down to the specific cause of what is going on, and we have to treat each problem, each deficit individually, and just work on the pain levels, work on their strength, their range of motion, and their function. And we have to try to educate a patient, trying to let them know that it's not just a quick, easy fix, but if they put their work in and listen to us educating them and going over the right things and follow through with the treatment program that we establish, that we will certainly be seeing improvements with their function and their pain, and they just need to be patient. And we're not looking for an immediate fix with physical therapy. It's more of a long-term, permanent fix when we're approaching a specific injury.
Now, is there a difference between men, women, and kids in the way you treat them? I would expect that because men and women certainly have different kinds of bodies, that there has to be a certain treatment that is a little different from one to the other. Is that true, or am I just talking out of my...
No, not necessarily. We treat, maybe children are a little bit different in the way that they learn, or the way that they are that they need to be taught a certain movement or exercise. Also, in how sometimes that they perceive pain and certain problems that they have. However, between men and women, we treat every single person, whether they're male, female, individually, and some men, some women can tolerate a lot more intense therapy, and some are going to be on the other side of the spectrum and cannot really tolerate too much. So, that's why we have a full assessment and evaluation for each and every patient, because we might have one that two men with the exact same injuries, let's say the same surgery, same surgeon, and they're going to be two completely different treatment programs based on their individual tolerance to pain, tolerance to exercise, their prior level of shape, prior level of exercise, and and also how much they are willing to put into their treatment program as well.
Now, we see, and I'm saying we, but I mean you see patients who, when they come to you, are in a lot of pain. Should they be taking medication and also physical therapy at the same time?
I always instruct my patients to not take pain medications before they come into treatment. I do not like to increase a patient's pain level. I also like for the body and to be able to let me know what is causing pain, because a heavy narcotic or pain medication can certainly mask what the body's trying to tell them as far as pain. So, we might be stretching a shoulder that the body, it doesn't really want to go much further, but the body's not telling you it hurts because of the pain medication, and we could be actually injuring the shoulder. So, I like to have the good feedback, not causing too much pain. Let the patient let us know when it is, at a point of tolerance. And then after the treatment, if a patient is in some discomfort and has some pain or difficulty sleeping at night, that is a better time to take some pain medication or over-the-counter anti-inflammatories.
Scott, there are a lot of different kinds of parts of the body, and I'm not sure that people understand what they are. I mean, I'm talking about muscles, ligaments, any other part of the body. Would you please give our audience a little description or a little more information about all these things that I'm talking about, like all the things I'm talking about?
Absolutely. With the physical therapist to treat pretty much every part of the body, ranging from, we could start with a joint, and your joints are what moves your body parts. So you have your shoulder joint, and that moves your shoulder joint gives you the ability to reach above your head, behind your back, out to the side. And what controls the actual joint are your tendons and muscles. So your tendons are attaches your muscle to your bone, and that basically controls the use of your joint. If there's inflammation in the joint, you're going to have pain inside that joint. If you have pain in the muscle around that joint, we are going to treat that specific muscle or tendon. Muscles turn into tendons, and that's basically what attaches and moves that bone and that joint around. And ligaments, on the other hand, ligaments connect two bones together. So if you have your ligaments in your elbow, it's basically attaching the bone in your lower arm with the bone in your upper arm. And a lot of times you have ligament strains and ligament tears that need a specific treatment as well.
I see. Now, so the song that we always hear, that one part is kind of connected to the other, makes a lot of sense, doesn't it?
Absolutely. If someone comes in with a hip issue, most likely, it's not always coming directly from that hip. Everything connects down to the knee, and the knee connects everything down into the foot. So sometimes an initial foot issue can really cause some knee, hip, and back issues. So that's why you need a professional like a physical therapist to analyze your specific issue, your movement, your function, and we can determine where there is a dysfunction or lack of movement or a weakness at, and that's what we try to address and fix.
Yeah. Well, we're almost at the end of the show, and I want to almost have you repeat the information to people who are going to have to deal with hurricanes and different kinds of weather conditions. So one more time, Scott, give our audience an idea of how to prepare, how to prevent different things from happening to your body that are absolutely a problem.
Well, it's all about hurricane preparedness, and if you are well prepared for a hurricane, you will be prepared for the cleanup and post storm issues as well. So, besides all the supplies that are needed for preparedness, you need to prepare your body as well. So, for one, you want to make sure that you get enough sleep. Sleep is very, very important. If you without sleep, you're more likely to injure yourself. You develop more weakness, more fatigue in your muscles, and that usually leads to injury as well. So, and then the next thing that's really important is your overall body mechanics when you're lifting or moving things. So know what you're lifting, how you're lifting it, because if something is too heavy, ask for assistance. Don't move something that you think might be too heavy or an awkward position that you can sustain further injuries than just back or muscular issues. And there's and that's going to require a lot more treatment than just physical therapy. So it's real important just to know proper lifting mechanics, right ways to move around when you are holding something heavy, and make sure you know what you're lifting before you lift something up.
Mm-hmm. Well, my guest today has been Scott Miller, a physical therapist in Delray Beach, Florida. Now, Scott is a very professional man, and because we're dealing with so many problems with our weather, he's been able to give you a lot of information and education. And so, Scott, if they want to get in touch with you, how do they do that?
The best way to get in touch with us is basically just to give feel free to give us a call at any time. Either myself or another therapist is usually available to answer any questions or to even give you a little consultation over the phone. The number here is 561-278-6055. And also, there's a lot of information, a lot of good articles, and a lot of details about the entire body and all different specific body injuries on our website. And the website is www.miller, that's MILLER-PT.com.
Well, thank you very much, Scott, for being on the show again. You're an absolute man and professional physical therapist who always gives our audience a great deal of information, and I'm very proud to say that I've discovered you, and you are always invited to be on the Susan Brender Show.
Well, thank you very much for inviting me, and I do appreciate the kind words. And for anyone out there that is preparing for a next storm, please, hope this information was educational and informative for you. And please give us a call or check out our website for any other information you may have that you may need.
Thank you very much.
Thank you for listening to Radio Reverb with host Susan Brender. Interested in being a guest? Contact sebrender@yahoo.com.